Hi, this is me, Dr.RUkmani Choudhary. In this video, we will be talking about IBS Irritable Bowel Syndrome. So, in today's video, we will be covering everything about IBS. What is IBS? What are the causes, risk factors, signs and symptoms, diagnostic criteria, management, precautions, home remedies, best effective homeopathic medicines. We will be talking about. You are requested to watch complete video for complete information. If you are new on our channel, and share our videos, and you can press the bell icon to get notified. What is IBS? See, IBS means Irritable Bowel Syndrome. This is completely different from IBS, that is Inflammatory Bowel Syndrome. It is just an irritability of your intestine. We call it spastic colon, mucus colitis. What problem you have in IBS? IBS basic features are you have irregular bowel habits or you have irregular stool characters. These are main two features you have in this. So this is you have the group of symptoms. At times you have constipation, you have loose motion, and the stool character varies from time to time. Let's talk about the causes. In IBS, there is no exact or direct cause. There are some possible causes believed that causes IBS. So number one blamed is oversensitivity of your intestine. Your intestine is irritated, it is oversensitive. So once you have food, your intestine responds, it's oversensitivity. So you have this problem, and if your lifestyle is sedentary, means you are not that much active. So lack of activity again causes this problem. Spastic colon, your colon is spastic. There is no there is a lack of peristalsis movement. Peristalsis movements are intestinal movements help in stool normal habits that maintain. So if you are less active, then there is less peristalsis movement, and there is a IBS symptoms are found. At times we found that IBS is related with the stress. Your intestinal movements again are controlled with your nervous system. So once you have stress, obviously you have stress, then your intestinal movements are disturbed. Where on a comparative study that women are more prone to have IBS to men, and the female who are menstruating have the more problem as compared to women who are already menopause. They have, so menstruating women have more problem. Let's talk about the types of IBS. There are different types. Usually we categorize in 4 types. The number one is if you have IBS of category constipation, means you are having hard stool, you are having constipation, then it is called IBS-C, IBS Irritable Bowel Syndrome, constipation. If you have your stool habits are loose, you are having diarrhea, you are having loose motion, then it is called IBS-D, means Irritable Bowel Syndrome, diarrhea. If you are having mixed category, means you are having constipation, you have at times you are having constipation, stool is hard, and other times you are having diarrhea, loose motion, so then it is called IBS-M, IBS mixed, Irritable Bowel Syndrome mixed. Times you don't fall in any category, then it is called IBS unsubtype. Vary from patient to patient. Talk about now the sign or symptoms of IBS. What suffering you have while you have this problem. See, IBS is a group of intestinal symptoms. It is not a single time you are having. We already discussed that you have at times you have constipation, you have loose motion, there is a cramping, abdominal pain, and you have bloating, gas, bloating is there, and you feel better after passing of the stool. You feel better. There is a stress is also blame stress the problem, and we already discussed that women are more prone, especially the menstruating female are more prone to have this problem. They around their periods they have the more problem. The main characteristic or diagnostic criteria is that you are having all the symptoms for regularly weekly basis for minimum 3 months, then it is under this category IBS. Let's talk about the diagnostic criteria or the test required. See, as we discussed in the causes that there is no direct cause, so there is no single test. Then we need to rule out other disease. If you are having any kind of food allergy, so your food allergy test should be done. If you are having lactose intolerance, you are having milk allergy, then it should be ruled out. That at times it is also coexist with the celiac disease, so your celiac test or celiac disease must be ruled out. Means it completely depends what all symptom you are having, and you other disease must be ruled out for the final diagnosis of the IBS. Your blood test should be done. All the blood tests are required. At times when you are anemic, you have these symptoms, so anemia should be ruled out. Anemia, intolerance, all these diseases must be ruled out for accessing final diagnosis for the IBS. Your colonoscopy can be done for the final assessment, like if there are any blockage, any symptoms. Talk about the treatment part. See, for talking about homeopathic medicine, you are requested to make some changes in your lifestyle, in your dietary habits. You can have short or frequent meals rather than having heavy meals, because your intestine is already irritated. So let heal itself. So and have short and frequent meals. Avoid any caffeinated drinks, tea, coffee. Avoid, because that again irritate your intestine. So better to avoid avoid chocolate, better to avoid cold drink, better to avoid tea and coffee. You can have short meals. We already just switch over your diet from heavy or fatty meal to vegetarian diet or fresh leafy vegetable. Just be physical active, mild or moderate activity. You engage with mild or moderate activity, so your intestine is there are natural movements and you are having natural bowel habits. So just modify, just adopt these help you with the IBS. Okay. And in dietary you can have yogurt and curd. Obviously that have healthy bacteria. It helps you in the digestion. So curd, you can add curd. If you're having, you can add. Now let's talk about the homeopathy medicine. The best in homeopathy, the medicine completely varies from patient to patient. That what is your history, what symptom you are having, what is your severity. The general medicine, you can have you are requested to use one medicine at a time. Analyze your case. Just use one medicine. Just self evaluate yourself. Match your symptom with the medicine symptom and take one medicine. Link are given on the description box. If you are watching on YouTube, just at a time. So we are having Argentum, Nitricum in homeopathy is very good medicine when you have nervous diarrhea. Means you are stressed, you are having nervousness and you have diarrhea after any news. So you can use Argentum, Nitricum. See, focus on the medicine name Argentum, Nitricum. Argentum, Nitricum 30 or 200 potency. So with the help of dropper, just 2 to 3 drops twice or thrice before meal. If you have problem while having direct medicine, you can add some water and you can, right? And we are having a Gelsemium. You must have heard about Gelsemium. Gelsemium again for the examination phobia, for nervous diarrhea. Again in Gelsemium you have drowsiness, you are lethargic, you are fatigued after loose motion diarrhea. So you can use Gelsemium again 30 or 200, one potency at a time, and you just start with the lower potency. Start with the 30. It is 200. You can start with 30. So again 2 to 3 drops twice or thrice before meal orally. Again 3 weeks, or if you start feeling better earlier, you can discontinue your medicine as earlier as well. There is no need to medicine. If you are feeling better, you just discontinue. If you are not feeling better, you can continue for a more having Arsenicum album. Arsenicum album is a polycrest, means medicine which is given in the many problems. So Arsenicum album again, if you are having anxiety, stress related IBS, then you just use Arsenicum album 30 potency. Again 2 to 3 drops twice or thrice before meal. Same way, maybe you just use medicine for 2 to 3 weeks. Having some prepared medicine, some in tablet form, some in liquid form. Having IBS, Holerina antidysenterica or Kurchi we call it. This is the best medicine in the tablet form. It is written over here, given in the irritable bowel syndrome. So you can use this medicine. This comes in the tablet form. These tablets pills you can take with the water, no problem. So these are the medicine. If you are having more symptom, 2 to 3 tablets twice or thrice before meal you can have. If you are having less symptom, one tablet twice or thrice you can have. It completely depends on your case. So this is Holerina antidysenterica, or it is also called good medicine for the even dysentery, for the IBS irritable bowel syndrome. Having IBS category C, means you are having IBS with constipation, you can use this medicine. This is again in the liquid form. So you just have 2 to 3 spoon of lukewarm water, 10 or 15 drops of the medicine, just mix and have twice or thrice before meal. This is written over here, this is the diarrhea drop. So if you are having IBS category D, means you are having irritable bowel syndrome with diarrhea, then just use this. Comes in the liquid form. So 10 to 15 drops in 2 to 3 again a spoon of water. Lukewarm water, use lukewarm water so medicine get absorbed easily and you have better results. The medicine completely varies from patient to patient, from case to case, severity of the case or history of the case. So hopefully these video can help you. If you find these video knowledgeable, please like and share our videos. If you are new on our YouTube channel, you can press the bell icon and subscribe our channel to get notified. We have put many videos on videos and skin, so you can press on them for the further information. Thank you for watching. Thank you so much.